Hello everybody, this is Dr. Connors. I want to make this video to help people understand the best nutraceutical approach to what they might be experiencing as possibly long haul COVID type symptoms, vaccine reaction type symptoms, exposure to people that are vaccinated type symptoms, chronic infection type symptoms. What am I supposed to do? There's a lot of different protocols out there. I think there's three distinct and separate and somewhat opposite approaches that we need to look at depending on what your problem is. So this is to help you identify what your problem is. So let's follow along. I'm going to try to make this as simple as possible, even though there's a lot of complexity to it. So if you have to listen to it a couple times, please do so. So I'm going to talk about three distinct reactions that people might be having at this point in history. One is a prolonged immune deficiency reaction. Two is an acute or prolonged immune enhancement. And three is an acute or prolonged toxic reaction. So we're going to discuss these in detail and try to break them down to help you self-diagnose yourself, really walk through this process in your mind, maybe talk to your local practitioner to help you with this as well. So the first response is this prolonged immune deficiency. This is the person that is really worn out. They feel sick. They feel flu-like. Like maybe they had this thing described as COVID several months ago and they seem to not have gotten over it. They still have no sense of smell. They still just feel exhausted. They feel like they're down in the dumps. They feel like they never get enough sleep. They feel like they could continue to sleep all day. They just never seem to have recovered from that. This is the first piece, a reaction. You treat this very differently than the next two. So this is truly what might be considered long COVID type symptoms, and it can be caused from maybe it's the COVID that's long standing that you're never able to overcome it. Many practitioners are believing that it is actually a reactivation of other latent viruses or biotoxins in your body that you maybe have had for decades and maybe never had symptoms of in the past. Epstein-Barr virus is one thing. There's some research articles that you can look up on this detail if you want to get really nerdy about it. Lyme disease that you might have been exposed to and feel like you overcame 10 years ago. Now you're getting those type of symptoms again. You feel limey, as some of my patients would say. The exposure to COVID, this exposure to spike proteins, exposure to EMFs, exposure to everything that's going on right now can reactivate that thing, can wake those viruses up that have been long dormant in your body. Maybe your immune system has kept them quiet and silenced them for a long period of time. Kind of like getting a cold sore again when you're exposed to lemon juice. Well, the cold sore, that virus, the herpes virus that causes a cold sore was always living in your nerve ganglion, and now it just had the opportunity to come out. We're getting those opportunistic type disorders come up that maybe were even worse than you experienced them in the first place. That is really an immune deficiency. That's what we're talking about in this first piece. These people need to support their immune system. This is where we created what we call our cold and flu bundle on our store. You can go, if you don't want to buy our products, I don't care. Go and look up the ingredients of these. These are some of the things. You might already have them in products in your cupboard. Look up what the ingredients are and start taking those things. You need to build up your immune system. There's other things you can do if you can identify, yeah, this is from my Lyme disease or this is from my Epstein-Barr. Then go back. How did you treat that Epstein-Barr when you had it 8 years ago. Well, I used this and this. Well, think about adding that same product again. What worked for you? So find out what latent disease, disorder, malady this is bringing to life, and try to identify that. If you have tools like a Rife machine, run programs for that thing. So that is the first piece, the immune deficiency worn out type issue that people get. The second distinct reaction is a little bit more complex and a little bit more dangerous, you could say. This is the acute prolonged immune enhancement. This could happen acutely, and in a severe acute enhancement that can be called antibody-dependent enhancement, it could be deadly. So getting a vaccine that causes an ADE, an antibody-dependent enhancement, you're basically firing an antibody reaction. The spike proteins are attaching to the cell membrane, causing an immune reaction that's destroying the cell, and it can be deadly if it's depending on where this is happening. So that's what's causing the acute pericarditis, the myocarditis. That's what's causing inflammation in the brain. On a more common level, it's happening more in a chronic manner. So you could say prolonged immune enhancement, the slow, chronic increased inflammation. Symptoms can be from unclear thinking, any brain type symptoms if it's going to cause inflammation in the brain, which could be symptoms that are affecting coordination, symptoms that are affecting balance, any hyperhistamine type reactions, any increase in heart rate, respiratory type symptoms, shortness of breath, anxiety, depression, mood disorders, headaches, memory issues, any increase in autoimmune symptoms. The list goes on beyond this. But this chronic inflammatory condition that's taking place, it really depends on what organ area that it's taking place in. A person could have chronic digestive issues, chronic urinary issues, bladder issues. The list could carry on indefinitely here, almost. This can be very dangerous because this increases. This hyperactivity of this immune system is increasing the pro-inflammatory cytokines. So cytokines is a specific immune signaling molecule in your body, and you have pro-inflammatory cytokines and anti-inflammatory cytokines. Cytokines that increase inflammation and cytokines that decrease inflammation. What we're talking about in this reaction is an increase in the pro-inflammatory cytokines. They are way down that tipping the balance of your immune response to very hyperinflation, inflammation. So your immune cells are completely imbalanced. You have a hyperimmune response. Different inflammatory cytokines like interleukin-6 and interleukin-23 actually block what are called Treg cells. Treg cells regulate the immune system and help bring it into balance, but they're blocked by these pro-inflammatory cytokines. And you develop this imbalance, and to the degree this is imbalanced is the degree that you'll have symptoms. Like I said, if this is in an acute pro-inflammatory, hyperinflammatory state to a severe degree, it can lead to death. So, but for most people, it won't cause sudden death. It will just cause chronic inflammation, chronic autoimmune disease, chronic pain, chronic headaches, chronic shortness of breath, chronic ill-ease, dis-ease in your body. So you have to calm that down. So the goal is to calm that down. Where is it going to affect you? It's going to affect you anywhere. These spike proteins could be anywhere that this inflammation could be. Typically, it's going to be worse in previously damaged tissue. So if you have any previous injury, you're going to end up with an enhancement more so in that area. An perfect example of that is in the brain. So in the brain, if you have a post-concussive issue in the past, maybe you played soccer or football as a youngster and you had multiple concussions, or you headed the ball all the time and you had some maybe nothing that knocked you out, but some minor little concussions, well, you're going to have some damage to the cells in the brain called the microglial cells, and then an insult like this that's going to increase pro-inflammatory cytokines throughout your whole body systemically is going to increase those pro-inflammatory cytokines in that already previously damaged, though you've been able to cope with it, area of your body, in this example the brain, and you have more inflammation on those microglial cells and an increased issue now with brain. You have increased memory issue, increased issue with depression or anxiety. It just exacerbates a condition that you once kind of had under control. So that's what we see with this type of thing. It actually gets worse. It's made worse if there's a greater amount of electromagnetic frequency exposure. So if you're exposed to a lot of dangerous EMFs, there's studies that show that this even makes it worse. So you have this inflammation, you already might have damaged tissue from previous injury, now you have an increase in pro-inflammatory cytokines, and you're exposed to a lot of EMFs. It even makes the condition worse. Here's some studies that you can look up if you pause this, and you can search those studies on PubMed and see the studies that prove that as well. So this is a totally different situation. The first one is a low immune response, and you want to build up your immune system. Well, these people with this condition would do far worse if they stimulated their immune system. So you want to calm the immune system down. You want to decrease inflammatory cytokines. You want to decrease histamines in your body. So you have to use a completely different approach. You wouldn't use immune-enhancing supplementation. That's where some people are on products that they hear about online that, oh, I should take vitamin C and immune stimulants to prevent. That's maybe what my problem is, and they tend to get worse. That's a sign that you're in this second piece, the second type of reaction. You want to take products that are going to calm the immune system. Sun Balance is a product that is a PEA product with quercetin, which is known to decrease histamines and decrease IL-6 levels. IAI, which is our product that I created for autoimmune disease, is a perfect product with curcumin, resveratrol, other flavonoids to decrease that pro-inflammatory response. And Histamine Scavenger is a great product with a bunch of different herbs that will decrease histamines and decrease those inflammatory cytokines. This is a very different approach, and you have to look at it differently. So you got these three things: a prolonged immune deficiency, well, you want to build up your immune system, and a prolonged or acute immune enhancement, well, we want to calm our immune system. Opposite approaches. You have to take an opposite approach at dealing with it. And then the third one may be something that you have in conjunction with one of the other two. So the third one isn't one or the other. You could have, number 3, an acute prolonged toxic reaction with a prolonged immune deficiency, or with a prolonged immune enhancement. So the toxic reaction is a toxic exposure to vaccine, to the environment, to poisons in your environment. There's lots of different sources that go way beyond what we've been experiencing in the last couple of years. So adjuvants from vaccines can cause this, spike proteins can cause this, released cellular toxins from past exposures to things that you've been exposed to can cause this, and endotoxins, which are toxins from cell damage and cells that are going through lysis and breaking down, or bacteria that's breaking down and and going through lysis. Those are endotoxins that your body has to clear away. So anything you could do to support liver detox pathways in this case is really your best approach. Think about doing coffee enemas. Think about doing hot packs over your liver. Think about supporting liver detox pathways. We have our specific detox bundle that was specifically created by me to help pull these things out of your body. That's a lot of different things. You don't have to take all of those, but this is a great approach to help pull this stuff out of your body if you've especially had to get vaccinated or you're exposed to a lot of people that are vaccinated. This is a great way to protect yourself. So those are our 3 approaches. The first 2 are very different and opposite to one another. If I have an immune deficiency, I want to build my immune system up. That's our cold and flu bundle. If I have immune enhancement and I'm having these immune reactions where I have a lot of inflammation and such, a lot of you might be in that and you are treating it wrong. So you want to go off of those immune stimulators for a period of time and treat it by calming the immune system down. So you're really calming the pro-inflammatory side of your immune system down when you're taking these. So you're not going to hurt yourself as far as not having an immune system, but you're getting rid of those hyper-inflammatory chemicals called cytokines in your body. That's our acute prolonged immune enhancement bundle. And then the specific detox bundle for detoxing everything that we're exposed to in our environment, including the things that we're exposed to now. So hopefully this clarifies things. If you have questions, you can look at each one of these different products on our store, and hopefully that will help you explain some things. I know we talked about a lot of stuff here, but go through it a couple of times, and we wish you the best. Thanks.